Hi, it's Dr. Thomas again from Chesapeake Chiropractic. Today we're going to go over some stretches for the lower back and the pelvis that you can do while lying flat on your back. You can do these stretches in bed if you are unable to get on and off the floor easily, or you can do them on a mat on the floor like I'm going to do. These stretches are appropriate for people whether they are acute, whether it's a brand new injury, or whether it's a chronic condition. We do recommend that people do these stretches twice a day and hold each stretch for 1 minute on each side. So you want to start with your knees bent and your pelvis flat. Let me scoot down a little. Okay. Your feet do not necessarily have to be as close as I have them, but this is the only way I could fit in the frame. So from this position, with your knees bent, your pelvis flat, if you have one leg extended, it's actually going to rock your pelvis forward, which is what you do not want to do because that creates an arch in the lower back and increases the amount of pressure that you're placing on your facet joints. So you want to start with both knees flat and bring your left knee back toward your chest. Hold this for 1 minute, and if you feel anything, you're just going to feel a little bit of a stretch along the erector spinae group, which basically are the muscles in the lower back that help to keep you standing upright. Place that foot back down on the floor and do the exact same thing on the opposite side. The second stretch is for the glute max, which we've gone over in a previous video, in a sitting position. This time, you'll bring your left foot, cross it in front of your right knee. From this position, keeping both shoulders flat on the ground, you're going to pull your left knee across your body toward the right shoulder and hold this for 1 minute. Again, place your foot flat back down and then do the exact thing on the right side. The last stretch is for the piriformis muscle, which is that small muscle that wraps from the edge of the sacrum to the top part of the hip joint. It's only about 2 finger widths wide, and it allows for external rotation in the hip. You'll start in the same position with your left ankle crossed in front of your right knee. Put both hands, reach between your right thigh with your left hand, reach around your right thigh on the outside with your right hand, and lift your right thigh back toward your body. You'll feel this stretch on the left side. This is a great stretch. Almost everyone feels this. Sometimes they call this the sign of 4 stretch because if you extend your right leg and you look down, it looks like your legs are forming the number 4. As always, we hope that you find these stretches to be helpful to you, especially during this time while you may not be able to get into the office. And if there's anything that we can do to help you, please reach out to the office. We are doing some telemedicine consultations, so that may be something that might be helpful for you if you need a little bit more individual attention while you're going over stretches, or if we can do